So let me ask you, you've been doing these remote conversations with experts and people that are facing challenges because of this horrible pandemic. And you've got this new episode, Oprah Talks COVID-19 on Apple TV+. It's being seen by people in 100 different countries, but you specifically wanted to focus on how COVID-19 is affecting Black Americans. And you have spoken to a number of people who've given you a perspective that I don't think a lot of people, when this pandemic first broke, were thinking about, because generally the most marginalized people in our society are not thought of at times of crises like this. What did you learn through these discussions?
What I learned is that there's a difference between communicating and connecting. And so I think that the message that was communicated, that if you have a pre-existing condition, was a valid message, but it did not connect to the audience in a way that they could hear. Pre-existing means you, if you are taking medication for hypertension, means you, if you are on an inhaler for asthma, means you, your son, your nephews, your cousins. It means you, if you are a diabetic or even pre-diabetic, if you have any lung issues, it means you. So I think that just like so many people when this was happening in Wuhan, we thought that was over there. I think all of us were guilty to an extent, perhaps maybe not you because you're in the news and you could see how it was moving. But I think a lot of Americans thought, oh, that was them over there. And then I talked to African Americans in Milwaukee, my former hometown where I grew up on welfare, many years with my mother living there on North 9th Street. And you know, the folks in Milwaukee were saying to me, we heard about it in Washington, but Washington's way over there. And we didn't think that that had anything to do with us because that's way over there. We didn't think it would be in directly in our community. And so when the head of the family, Lawrence, ended up with a cold, they thought it was just a cold. And then when it got progressively worse in 3 days, and on the 4th day, you're going to the hospital, they didn't expect for him to be dead by the 5th. So I just have to say, it's taking people out, it's real. And this is what I want to say to our community in particular, because I think people now are hearing the message because media is now putting this on high alert for all people and Black people to understand that it affects us if there are pre-existing conditions. But I think people aren't still getting the message that it's not just the people who you see have it or you think might have it. It's the people who are asymptomatic. It's why in my own house, one of my beloved daughters from South Africa wanted to come home from Stanford. And I said, you can't come because there's no way for me to get you here. You can't take a train, not gonna be on a bus, not gonna be on a plane, opening yourself up to everybody there. Only way you can come is that I can send security to get you, and then you put security in danger because I don't know where you've been or who you've been around. And so that daughter is still living alone in her own apartment, and we all FaceTime every night, but I didn't let her come into the space just because I thought, even if you endanger one other person who has to come and get you. So it's not the people who you know have it, who are sneezing and aches and pains, it's the people who perhaps are asymptomatic. And at the beginning of the series, I had the pleasure of interviewing Idris and his wife who were in quarantine in New Mexico. Never did they show a symptom, ever. They were asymptomatic and never through the whole two weeks quarantine, and then after did they ever show a symptom. So I think it's all of these people who perhaps could be carriers and then bringing it into your home. So it's not just, I want to say to folks, not just isolating yourself, but don't let anybody else come in your house.
Right. And so a couple of points that you just made that I want to sort of focus on. You talked about Milwaukee, and what we've seen, a really distressing statistic that we've seen replicated over and over again, is in cities and in states where Black people are not the majority, they are disproportionately affected by COVID-19. 70% of the deaths in Chicago are Black Americans, yet they only make up 30% of the population. And you spoke to Mayor Lori Lightfoot. What did she tell you?
Well, she told me that, the same thing I think that she shared at that news conference, only she spoke in depth about how the numbers just take your breath away and how difficult it is when you are living in housing where you have no way of getting away from the rest of the people in the house, except to close off a room and put yourself in a room, how social distancing in the African-American community is far more difficult in the African-American and Brown community because you have more people living in the home. And I talked to a minister on the South Side of Chicago for this series who lost his sister and his best friend since high school within the same couple of days due to COVID, wasn't able to be with either of them at the end, and wasn't even able to have a funeral. I think that's what people don't understand, is that it's taking people out. The family in Milwaukee told me they couldn't believe that in 5 days, their family member was gone. They're still looking at the chair that he sat in every night in the living room. You just can't believe. They're sharing with me that we hear 14 days. They thought they had 14 days. In many cases, you don't have 14 days. If the virus hits, it hits your lungs, you're out, you're gone. And so for those who can't recover, particularly with pre-existing conditions, and all the people I talked to also had pre-existing conditions, diabetes, heart disease, hypertension. And so I'm using every platform that I know of. That's why Apple TV is allowing owned broadcasts, because it's not even a matter of business. It's just a matter of how many people can you reach to get this message across. So I thank you for the opportunity also.
Of course, it's me that's honored to be able to talk to you about such an important subject. And you also spoke to Nicole Hannah-Jones, who I'm a huge fan of, who's such a wonderful writer.
As am I.
New York Times. And, Nicole's been writing and talking about this a lot. And, she highlights things I think that sometimes people do not stop and think about when we talk about comorbidities, or the fact that a lot of Black and Brown people will be your postal worker, your cashier, your grocer. They live in areas where they are perhaps more prone to asthma because they're closer to highways in some parts of the country. Absolutely. And she says that,
or live in areas where there have been, there's been toxic dumps or toxic waste, or living in environments that don't allow you to have the best access to healthcare, to have the best access to insurance. And so all of the other structural issues that have been in place to cause people to be oppressed for centuries are in play when it comes to this disease. So if you were in a position where you literally were just trying to make ends meet, to take care of yourself and to get health insurance and to be able to benefit your health, and then something like this strikes, it's almost impossible to overcome it. And that's one of the things I've been thinking about for when we actually get through this, which we all know that this will eventually pass and we will get through it. And I think for every one of us, Vlad, we come away from this experience changed. And if it doesn't change you in some way, then you miss the point. I don't want to see what has to happen to actually change you. And I think when we come out on the other side, every person, not just in America, but throughout the world, is going to be more appreciative of the simple things in life, the things that you can't do now that you took for granted, taking a walk, going for a bike ride, going to the store, buying what you want, even sharing a hug, being able to congregate with your friends, all those feelings that we're having now, everything that you're missing, everything that you're feeling anxiety about, that's what this moment is supposed to slow us down and get us to consider, I believe, deeply, spiritually in my soul, that along with all the scientific, biological stuff that's happening, that there is a major spiritual calling here and a truth awakening for the world, for the humans of the world, to come out on the other side better than we were when we went in. And so what is going to be called for is for each of us, those of us who have, to to put ourselves in a position to be more open to help the have-nots, because there are going to be a lot more have-nots in every area of life. So it's caused me to think more seriously about what I really want to do with the rest of my life. If if I am blessed to be spared from this disease, and how I want to use my philanthropy in a way to lift other people up. So yes, I am donating $10 million, but that's just a start, because whatever is happening now with people needing food banks and people needing services is going to be 10 times worse on the other side of this.